There was an onion cut in half in the sock of every feverish child on that farm. In 1954, families swore it pulled a fever overnight, and by morning, the fever was usually gone. The fever was gone, the onion did not do it. I'm going to be straight with you from the first minute because this is the one subject on this channel where I will not tell you a comfortable story. That onion has been in American farmhouses for 150 years. It went in the sock, or on the soles of the feet, or on the chest, and it came out in the morning gone dark and soft, and everybody looked at that blackened onion and said, "There it is." That is what it drew out. It drew out nothing. An onion turns dark because cut onion exposed to air turns dark. That is oxidation. And it will do exactly the same thing on a plate on your counter next to a person who is perfectly well. Now stay with me because I am not here to make fun of anybody's grandmother. I am here to tell you that those women were doing something real that night and it was not the onion, and the real thing has been thrown out along with the folklore. That is the loss worth being angry about. I grew up hearing about the onion. I also grew up hearing what my grandmother actually did in that room, which was a great deal more than putting a vegetable in a sock, and the difference between the two is the whole of this video. By the end of this, you will know what a fever actually is, and it is not what most people think. You will know the one piece of information about a sick person that matters most, and it is not the number on the thermometer. You will know the list of signs that mean you stop reading and go tonight, no waiting, and you will know two old fever remedies that are genuinely dangerous and are still being passed around. I want to say plainly before we go on that I am not a doctor, and this is not medical advice for you or your family. It is general information about what a fever is and what the old home nursing actually consisted of. Anything about a specific person goes to a doctor or a nurse line, and most places have one you can call for free at any hour. Here is the reframe. A fever is not the illness. A fever is the fight. That is the thing almost everybody has backward, and it changes what you do in that room. When your body detects an infection, it deliberately raises its own temperature. It is not broken and it is not being overwhelmed. It has turned the thermostat up on purpose because a raised temperature makes life harder for a great many bacteria and viruses, and it makes parts of your immune system work faster. Like the fever is the response, not the disease. So when you bring a fever down, understand exactly what you have and have not done. You have made a person more comfortable. That is worthwhile, and it is a real kindness, but you have not treated anything. The infection is exactly where it was, and the number coming down does not mean the illness is going. And that leads straight to the thing I most want you to take out of this. The number on the thermometer is close to the least useful piece of information you have. That will sound wrong because we have all been trained to treat it as the score. But a moderate fever in somebody sitting up, drinking, talking, complaining about being bored is a far better situation than a low fever in somebody who is limp, will not drink, and is not really looking at you. How the person looks and behaves tells you more than the reading does. Are they drinking? Are they making water? Do they rouse properly? Are they breathing easily? Is their color right? That is the assessment, and it is the one those farm women were making over and over all night without a thermometer in many cases at all. They were not treating the fever, they were watching the person, and here is why the onion survived, and it is not stupidity. It is arithmetic. Almost every fever breaks. Most of the illnesses that cause a fever in an otherwise healthy person are self-limiting, which means the body wins in a day or two or three, whatever anybody does. So if you put an onion in a sock on Tuesday night and the fever is gone Wednesday morning, the onion appears to have worked, and it appears to have worked nearly every single time you try it. That is the most convincing kind of false evidence there is. It has a 100% hit rate against a condition that was going to resolve anyway. Anything you did that night would have carried the same credit. The onion just happened to be the thing in the sock, and there is a second reason it stuck, and this one I have some sympathy for. Sitting up all night with a sick child and doing nothing is unbearable. The onion gave a frightened parent a job. It gave the hand something to do at 2 in the morning. That is not nothing, and I understand it completely, but it is comfort for the parent, and we should be honest about which one of them it was treating. Now, let me tell you what she actually did, because this is the part that got lost. The night I always think about, my grandmother did not reach for an onion at all. One of the children in that house came down sick in the evening, and by 9 o'clock she had stopped going back and forth to the kitchen, and she had pulled a chair up beside the bed and stayed there. She was not doing anything dramatic. She put a hand on the child's forehead and on the back of the neck. She got water into her a sip at a time, all night, more or less every time she woke. She kept one blanket on her, not four. She kept the lamp low, and she asked her a question every so often, something simple, just to hear the answer come back right. That was the whole of it. Water, rest, a cool, quiet room, one light cover, and a person sitting there with their eyes on the patient. And then the part that was the actual skill. Somewhere in the small hours, she went and woke my grandfather and told him to hitch up. And they took that child to town in the dark on a bad road. She had seen something she did not like. I never got a straight answer about what it was, but she knew the difference between a fever she could sit with and a fever that had to be somebody else's problem, and she knew it at 3 in the morning with no telephone and no way to check. That was the trick. Not the onion, the judgment, and I want you to notice what she had to work with when she made that call. No thermometer she trusted, no telephone, no way to look anything up, and nobody to ask. She had a lamp, her own two hands, and however many years of having sat in that chair before. That was the entire instrument panel, and she read it correctly. If this is already making you rethink what you thought that generation was doing, do me a favor. Hit that like button, subscribe, and turn the notification bell on while you're there. I put out one of these every week. The old practical knowledge that worked, told honestly, including the parts where the old way was wrong. The bell is the only way these reach you, then stay right here because the next part is the one I would want my own family to know. Now, the money, and this one is small and honest, but first understand what a doctor costs because it explains everything about why that room existed. A house call in the middle of the 1950s ran a few dollars, an office visit not much less, and a hospital stay was the kind of number that could take a year out of a farm. That came out of the same pocket that bought seed. So the decision to hitch up and go was never only a medical decision. It was a financial one made at 3 in the morning by somebody exhausted. That is the pressure those women were under, and it is why the judgment mattered. Going too early cost money the family did not have. Going too late cost something worse. Nobody got rich on onions. There is no villain in a sock. But look at what filled the space when the home nursing went away. There is a whole shelf of fever products now, and most of it is the same two medicines in different packages and flavors and strengths, sold at very different prices per dose. And around that shelf sits a second ring of things with no business being there at all: elderberry and vitamin megadoses and immune boosters and syrups that will not touch an infection. What none of that shelf sells you is the actual competence. Nobody makes money teaching you what to watch for, when to keep somebody home, and when to go. That is the part that was in those farmhouses and is not in the aisle. And notice how the products are framed. Almost all of them are sold on the number, reduces fever fast, brings temperature down. Not one of them is sold on the thing that actually matters, which is whether the person in front of you is doing all right, because you cannot put that on a box and you cannot charge for it. I'm not telling you there is a room somewhere where men decided this. There is not. And the two real medicines on that shelf are genuinely useful for making a sick person comfortable. What happened is simpler and worse. It is a quiet agreement among everybody who profits to sell a treatment for the number, because the number is a thing you can sell against. Judgment has no packaging, nobody has to coordinate, and nobody has to lie, and it has been that way for 50 years. Now, here is the part that matters more than everything before it, and I would ask you to actually listen to this section rather than half hear it. These are the signs that mean you stop what you are doing and get medical help tonight, not in the morning. Any fever at all in a baby under 3 months old, any. That one is not a judgment call, it is a straight trip to be seen, and every doctor in the country will tell you the same. A stiff neck, a bad headache with the fever, or a strong dislike of light, a rash that does not fade when you press a clear glass against it, trouble breathing, fast breathing, or the skin pulling in around the ribs or the base of the throat, confusion, not making sense, difficulty waking somebody up, or a person who is unusually limp or floppy, a seizure, signs of real dehydration, no wet diapers for many hours, no tears when crying, a dry mouth, sunken eyes, no water passed all day, a fever that has gone on more than about 3 days, or one that went away and came back, or one that keeps climbing, severe pain anywhere, and anybody whose immune system is compromised, anybody on chemotherapy, anybody very elderly, anybody with a serious ongoing condition. For those people, the ordinary rules do not apply, and a fever gets a phone call early rather than late. If any of that is present, this video is over, and you should be doing something else. And if you are simply uneasy, if something about how that person looks is bothering you and you cannot say why, that instinct is worth more than any list I can read out. Call That is what the nurse line is for, and they will not think less of you. If that landed, hit like and subscribe, and ring that bell. Now, here are the two old remedies that are genuinely dangerous because they are still circulating. Never sponge or rub a person down with rubbing alcohol. This was done for generations and it is seriously harmful. Alcohol goes through the skin and it comes off as vapor that gets breathed, and in a child it can drop blood sugar and cause coma. It has killed people. If you take one warning from this video, take that one. And never put a feverish person, particularly a child, into a cold or ice bath. It feels like the obvious move and it backfires. Cold makes the body shiver, shivering generates heat, and you can drive the core temperature up while making somebody thoroughly miserable. Lukewarm is the most anybody should ever do, and comfort is the goal rather than the number. Two more while we are here. Do not give aspirin to a child or teenager with a fever or a viral illness. There is a rare but very serious condition called Ray's syndrome linked to it, which is why the advice changed a generation ago, and a great many older people were never told. And do not bundle a feverish person under a heap of blankets to sweat it out. One light cover. Sweating it out is not a mechanism, it is a saying. And with any medicine, follow the label and the dose for the actual weight and age. Watch that you are not doubling up the same ingredient in two different products, which happens easily with combination cold remedies, and ask a pharmacist if you are unsure. They will answer that question for nothing. So here is what the old home nursing actually was, and all of it still stands. Fluids, constantly and in small amounts. That is the single most useful thing you will do all night. Water, broth, whatever they will take. Small sips beat a big glass because a sick stomach handles them better. Rest in a room that is comfortable rather than hot. One light cover. Let them kick it off if they want to. Comfort over numbers. If they are miserable, a fever reducer at the correct dose will help them sleep, and sleep is genuinely useful. If they are sleeping already and reasonably comfortable, there is no rule that says you must wake somebody up to bring a number down. Watch and write it down. That is the part that has been lost, and it costs nothing. A piece of paper by the bed, time, temperature, if you have it, what they drank, whether they passed water, how they seemed. Two things come of that. You will see a trend you would otherwise miss at 4 in the morning on no sleep. And if you do end up in front of a doctor, you can hand over an actual record instead of trying to remember, and any doctor will be glad of it. And keep the patient in one room where you can hear them, which is exactly why those old houses had a sick room near the kitchen. Usually the one place with a stove close by and a door somebody could leave open. There is one more piece of it that sounds too soft to be a method, and it is not. Company. Somebody sick and frightened who is left alone in a room gets worse in every way that can be measured, sleeps less, drinks less, and calls out more. Somebody with a person in the chair beside them settles. That chair was doing a job, and if you have ever sat in one, you know exactly what I mean. One more thing, because it is the part I actually think about. That generation was not superstitious in the way we like to imagine. They were 30 miles from a doctor on roads that were not roads, and a doctor cost money a farm did not always have. And so a woman in that house had to be the first line for everything that came through the door. She nursed people through illnesses that would frighten us now, in a room with a lamp in it on her own. Some of what she used was nonsense. The onion was nonsense, but the nonsense sat alongside a real and hard-won competence. And when we threw out the onion, we somehow threw out the watching with it, and the watching was the part worth keeping. I asked my grandmother once late on whether she had believed in the onion. She said she had never thought much about it either way. She said the onion was for the mother. The water was for the child. If you have gotten this far with me, hit like, subscribe, and turn on that bell. Nobody sponsors a video that says the folk remedy does not work, and the answer is a glass of water and paying attention, so the only thing keeping this in front of people is you. You did not forget this. Nobody taught you, and then you forgot. What was taken from you was not medicine, and I would never tell you that. Medicine got better, hugely better, and that is a plain good thing. What was taken was the confidence to sit up with somebody, and the judgment to know the difference between a night you can manage and a night you cannot, and nobody replaced it with anything except a shelf of boxes and a feeling that you are not qualified to be in the room. You are qualified to be in the room. That is what she had. And it was mostly attention, and I would rather you took that away than any remedy, because attention is the thing that scales. It works on a child with a fever, and it works on an old man who has gone quiet at the table, and it works on anybody in your house who is not quite right and cannot say why. Somebody has to be the one who notices. In that farmhouse, everybody knew who that person was. So Do one thing this week while nobody is sick, because that is the time to do it. Find the number for your doctor's after hours line or your local nurse advice line and then put it somewhere you will find it at 3 in the morning. Then tell me in the comments what your family used to do, what county you are in, and whether the onion was in the sock or on the chest where you grew up, because I read everyone, and those stories are the reason I keep recording. And if this rang true to you, come back for the next one, because I am going to show you how she kept a cast iron skillet slicker than any coated pan sold today, why the thing everybody does at the sink is quietly ruining it, and the one step that takes 10 minutes and lasts a generation. Nobody sells it, so nobody teaches it. I will. Keep it simple, keep it yours. And remember, the people who sat up all night with a lamp and a glass of water knew things we are only starting to remember.